Air pollution from PM 2.5 and ozone kills about as many Americans each year as all transportation accidents, plus all gun shootings combined. Over 4 million, so 4.1 million deaths in the year 2019 attributable to particulate matter pollution. That accounts for actually 7% of all deaths in the world.
There has been some studies that have come out of our core project as well as Tiger teams that have used remote sensing to address sort of new facets of the global health burden associated with air pollution.
So for our global ozone mapping project that supported the global burden of disease assessment, we worked with the Institute of Health Metrics and Evaluation.
Through my work in the global burden of disease, was contacted by Jason West. But I've worked actually with many of the other HAQAST contributors.
And then our linkage with CDC has been key. They are a partner, so we've done some research with them, but they're also a stakeholder in the sense that they are very interested in the work that we're doing and translating it into indicators.
Through HAQAST, we've developed a relationship with ICCT, the International Council on Clean Transportation. And the tools that we've developed help them estimate the impacts of different emissions changes from transportation on air quality and health.
I'm really proud of our work that analyzed surface ozone concentrations all around the world. It was a tough task in terms of doing data fusion that pushed the methods that we're using now to a global scale.
I would say that the most impactful has probably been our work with stakeholders in the pollen and health space. We've made a lot of progress to develop better indicators for monitoring changes in pollen, impacts on health, how changes in weather and climate may affect those going forward, and how that information can be brought back to practicing allergists, to public health practitioners.
We have built the capability into this tool for these planners to look at air quality impacts. Now they can estimate what is the impact on PM, on ozone, and what are the associated impacts on health, or climate, or ecosystems from these changes in air quality pollutants.
And the kinds of tools that HAQAST has been developing really not only fill in the gaps, but I think can provide sort of an enhanced product so that we actually have better information